And all of a sudden he started acting like a completely different person. And his family called me and said, Kim, he's like being suicidal. He's trying to lock himself in his room. And he'd had a previous injury that created some scar tissue. And I'm like, you know what? Maybe he's having a neck issue problem or neck problem that's impacting the blood flow to the brain because it was just a drastic change. So I said, do you mind if I come over and we check? And Tina went through a situation where someone was in her house that was kind of out of it. And we're like, this is what we think's happening to this woman. And people might think it's dementia or, again, with this young man, a mental health crisis. I got him on my side and he trusted me. I said, hey, can I do a muscle test? And I think if he had never met me before, his psyche again wouldn't have even allowed me around him, or he wouldn't have let me in. But because he like remembered me, he had met me before, he was like really standoffish to his parents, but he was allowing me in. I said, look, hey, I just want to check a muscle imbalance. Do you mind? And he lay down on the floor. I checked his muscles, and sure enough, there was a neck muscle that was causing a problem. And I'm telling you, this young man within 15 minutes was a completely different person. And so his muscles in his neck were causing intermittent changes to blood flow and or impacting a nerve that was changing communication. Like right then I didn't have like some kind of diagnostic tool that I could tell whether it was artery or the nerve or both. But because I've worked with intermittent vertebral basilar insufficiency due to a muscle slightly cutting off arterial blood flow, and have seen the changes that it makes in people, how they act mentally, physically, how their body feels, I knew there had to be something. And as soon as we corrected the neck problem, he changed. And so the brain, the nerves, and the muscles may malfunction due to a deficiency. Like a muscle might tighten due to like a calcium deficiency. And then it can press on an artery or nerve that causes that person to have severe symptoms, or like look catatonic. They could look out of it or have seizure-like activity. They could have had like simple whiplash the week, not, and I know whiplash doesn't sound simple, but I had one person, they had whiplash from a roller coaster that they thought it was all fun, but it caused whiplash. And then I had another person that I've told some of you about before that was a corrections officer. Someone threw a deodorant stick at him, an inmate, and he just went like that. That was it. But it was a quick jerk, and it caused the muscles to tighten just enough to impact the communication to the brain and then also the arterial, the blood flow. So if someone also has a hormonal imbalance, like if they have excess estrogen, it can tighten the muscles and cause the same thing. So we got to look, is something going on with like their eye, their neck, or jaw that's changing their mental health? If someone has an eye muscle issue, they can often have anxiety and panic attacks. Now, even the neck will cause an anxiety issue. But most often, let's say someone's having a panic attack driving and they've never had anxiety driving. Now, all of a sudden, they're getting anxiety all the time. They almost always, like 90% of the time, have an eye muscle issue where an eye muscle is compensating incorrectly and kind of overloading the brain, because when they're driving, they're having to try to assess everything at once and the brain gets overloaded. Because let's say there's a muscle called the lateral rectus muscle. Let's say the lateral rectus muscle, the right eye is too tight or it's overworking and it's trying to pull the eye right, like a car being pulled out of alignment, and you're trying to center it. And your brain's trying to look straight plus assess everything around you. It's like this constant tug of war in the brain and with the nervous system because that eye muscle issue, and it will cause a panic attack. They'll have to pull over. I've had people literally envision like driving themselves into a tree. And there are people, they're like, Kim, this has never been me. What's happening? And every time I've muscle tested them, there's been an eye muscle issue going on. So again, what physician as a whole is truly going to ever check that? And like, so they're going to typically give them some kind of anxiety med. My mom years ago was hospitalized for this. Like she thought maybe she was having a stroke. I said, look, mom, let's just go to the hospital, because 3 or 4 times she had this happen driving and someone had to come get her. I said, let's have them run every test possible. They never found it. It was a neck problem and a zinc deficiency, but it was before like I knew what I knew. So it took time to put everything together, you know? So the goal for people is to have a neuromuscular assessment by a qualified neuromuscular restoration specialist for us to reverse that compensation. So those of you that work with me, I can do a neuromuscular assessment for you or do a virtual one, but I also have multiple people that I've trained how to do this, that they can help you. And then some of you heard that we had that international wellness team now where we're helping virtually, where we have all of us on the call, just so that way we can all offer support looking at from a different set of professional eyes. So if you know someone that needs help with this, or they just drastically change and you need to call us for an emergency appointment, call or message, just reach out, because sometimes there's no one for me to refer you to that understands this or is willing to work with it. Like they're like, oh no, Just go hospitalize a person. You know, don't need to call the cops. And most times that's not the case. Sometimes yes, but most times it's not. So know that there's so many intricate parts that could be causing this. And now what's crazy is, let's say the person could have been skipping meals, they could be having more caffeine, and they might have had a issue happen with their neck, and it's all three at once. So like maybe someone changed their caffeine and didn't get better. Maybe someone changed something and it didn't change. We have to look at all three things. Like they have to eat a little bit more, they have to get more protein, they have to change the caffeine, and we have to fix the neck muscle. So it might not just be one of these things. It could be 5 things from what I initially said as the most common things. But what's so amazing is if you fix those 5 things, that person could be a completely different human. Like when I saw people that were like generally healthy and happy, and they'd be like bubbly, I thought they were such a bitch at home and they were just being fake, because I'm like, there's no way that person's that happy, because I was knowing how I felt. Like I was always on for the public, but then at home I might lose it. But I didn't know that you actually could feel that way most of the time, especially if you ate and didn't overwork and you didn't talk crap to yourself all day long. So I thought it was normal to like be on for the public and then just be, checking out at home. And so once you really look at all of these angles and get them in balance, you can really feel happy and not be fake. And you can manage a big workload. Like someone might lose it every day on a normal basis, but once they correct this, maybe twice a year, they feel like they fall out of character versus twice a week. So it's really amazing if we just learn a little bit more about how the body works and what it needs, and we address it like one step at a time. It's amazing what we can evolve into. But if it's a crisis, like we'll talk about like how we take care of it immediately to try to reduce trauma, or like where someone needs to look that the doctors have not been looking. Because that's what I get called for the most. Most people have already been seen by the professionals, or they're maybe still hospitalized, and it's not stabilizing. So then a family member that knows of me will be like, Kim, do you think I can help? I don't know if I can convince my brother to let you help his son or whatever. But I'll tell them, even if they don't want to work with me, tell them, look in these areas and see. And that's one reason I was recording this workshop, is one, I'm working on a book that's like the cliff notes of this, but I wanted them to have access to this workshop that maybe they can't hire me yet, or they're not sure whether to trust that guidance because I'm not an MD. But I can send this to that family to listen to and watch, so that they're going to learn the other steps that we didn't know existed. So maybe they can look into this, or it'll trigger an aha moment like, wait a minute. Yeah, they were on a roller coaster the week before they started having these changes. I mean, literally the young lady that I just started helping that's being overtrained by her swim coach, she started having these weird seizure-like activity and extreme mood changes, like extreme, like anger with her boyfriend. And another one I worked with had extreme laughing. Well, they said she went to grad bash the night before, and the next day she had this weird seizure, and she's had 5 seizures. She's had a mood change. She was hitting on her boyfriend, like physically wanting to hit him. And I said, grad bash, was that at Universal? And they're like, yeah. I said, how many roller coasters did you ride? And she's like, oh, I rode them all night. And then I stayed up till 2 a.m. and I didn't eat and blah, blah. So sure enough, she had a neck muscle that was triggered from the roller coaster. Nobody knew that it could cause this change in behavior. And literally we met one time. She's never had a seizure since. She's feeling best. She has now. We've met 2 more times just to work on other things now. But again, she was misdiagnosed, mistreated, and they just wanted to put her on like Keppra for anti-seizure medicine and tell her that she was epileptic.